Hi friends, today we are going to take a new video series on the public awareness series. This section will deal with the details of public health. What do you mean by public health? It is different from the clinical medicine and clinical dentistry. In this public health, the health of the population is being considered and the quality of life of the population is being improved. The ways to improve the health of the population is being considered, and the different aspects of health and improvement at the population level is considered. Now we look at the components or the divisions that are present within the public health. The first division is the epidemiology. It shows the number of population that are affected by a disease. So if we take the example of the coronavirus, we can show that around billions of people have been affected by the coronavirus epidemic. So the epidemiologist helps to understand and calculate the amount of people and burden of disease in a population. And the next section is the people who are doing the biostatics. This people helps to identify the medical or statistical calculations within the public health. So if you take the example of coronavirus, if you need to understand the percentage of vaccinated people in a population against a coronavirus, the biostatistician will provide a bar chart or different kinds of chart. By this, the government can understand how this vaccination process have been going on and the steps needed to improve the vaccination process. So the next section is the medical ethics. So for doing any kind of research in medicine, dentistry and healthcare, the medical ethicist role is important and they need to give the approval for the animal research and the human research. The next field is the sociology. As we all know, every disease is affected by certain kinds of sociological factors. For instance, if take an example of diabetes, if a person is suffering from the diabetes, he may be having bad food habits or he is not undergoing any exercise regularly. These are the social factors that is associated with the diabetes, or he may be taking alcohol at a increased level. So these are the social factors or the behavioral factors that is affecting a disease. And the next section is the health economics. This health economics is one of the most important aspects of public health. This health economics provides the data for the planning and evaluation of the health programs at a population level. So now we go on to look at the specific duties of the public health professional. The duties of public health professionals include conducting epidemiological surveys in a population, conducting biostatistical calculations for the disease in a condition, and giving ethical approvals for the research process in healthcare, and identifying the sociological aspects of a disease and do the planning process, do the healthcare economics planning, and finally the early detection of cancers through the screening process. This is one of the most important significant role of public health dentists. So by this effective screening and early diagnosis, the cancer mortality can be reduced. So this public health specialist provide a wide varieties of job within the medical and dental fraternity.